Good evening, ladies and gentlemen. My name is Anita Nielsen, and I'm the Senior Director of Annual and Planned Giving here at Toronto General and Western Hospital Foundation. And I'm delighted to welcome you to the first behind-the-scenes lecture of 2011. For those of you that are still looking for seating, we have staff that are standing around, and they'll wave and point to where there are still some available seats, but we certainly have a full house today, and really are delighted that you would come down on this gorgeous spring afternoon and spend time with us. The behind-the-scenes lectures were developed to provide you with an exclusive view of how our scientists and clinicians discover, develop, and refine the best treatments for patients. These lectures also provide us with an opportunity to show our appreciation and how grateful we are for your support, and to thank you for the generous gifts that you make to our hospitals. At UHN, our purpose statement, transforming healthcare for our patients, our community, and the world, is lived every day by our clinicians and scientists who conduct cutting-edge research and best practices that translate into better care for our patients. Our hospitals are also research-intensive, which means that the translation of innovative discoveries into clinical therapeutics is a relatively seamless process. Toronto General Hospital and Toronto Western Hospital undertake some of the most complex cases in Ontario and across Canada. And there's much to share with you about the innovations in our practices that transform patient care. Especially exciting for us are the leaps and bounds in cardiac care. Today's lecture will be presented by two internationally renowned medical leaders, Dr. Heather Ross and Dr. Vivek Rao. They're each going to share some of the incredible work that's taking place in their respective programs in the Peter Munk Cardiac Centre, as well as some of the exciting initiatives and milestones that they will be working on. The Peter Munk Cardiac Centre is one of the top cardiac centres in the world. And to introduce some of our accomplishments and our speakers today, I'd like to invite Linda Goldsack up to the podium. Linda is the campaign chair of the Peter Munk Cardiac Centre, and she will make introductions. Thank you very much.
Thank you, Anita. Good afternoon, ladies and gentlemen, and thank you so much for coming out this afternoon. What an incredible turnout to celebrate what happens at this incredible institution. It's just amazing to see so many faces out. Before we move into talking about Dr. Rao and Dr. Ross and their work, though, I would like to introduce another one of our senior scientists, Dr. Christopher Page. Dr. Page is the Vice President of Research at University Health Network. He holds the Ronald Buick Chair in Cancer Research and is professor in the Departments of Immunology and Medical Biophysics at the University of Toronto. And Dr. Page has a unique announcement and a special one to make. Dr. Page?
Thank you, Linda. And on behalf of the University Health Network, I'd like to welcome you all to this exciting program. As you know, UHN is a research hospital with a mission of global impact. And we achieve that by creating new and better ways to treat our patients here in Toronto, and then provide that knowledge to many top medical centers around the world. The talks you're going to hear today from Drs. Rao and Ross are perfect examples of best-in-class medical research leading to better outcomes for our patients. And you better listen to them carefully, because there will be a quiz at the end for you to leave. But before that, I'm very excited to announce that the research arm of the Toronto General Hospital has just named a new director of research. Dr. Mansour Hussain is a cardiologist here at TGH and a top researcher in cardiovascular disease. He's currently the director of research in the Peter Munk Cardiac Centre and at the University of Toronto's Lower Centre. He holds competitive research grants from top-tier funding agencies and is invited all around the world to talk about the research breakthroughs that come from his own laboratory. So it's with great pleasure that I invite Dr. Mansoor Hussain, to say a few words. Thank you.
Thank you, Chris. It's a pleasure for me to be here tonight. Good evening, ladies and gentlemen. I'm very honored to be the new director of the Toronto General Research Institute, and truly privileged to be given an opportunity to help shape the research future of our hospital. For the last 13 years, I've been a clinician scientist at this hospital. As a cardiologist, I work in the cardiac intensive care unit, where I have the humbling responsibility of taking care of some of the most critically ill patients in this hospital. And I can't tell you what a comfort it is to me that at any time of the day or the night, I can pick up the phone and speak to Dr. Heather Ross or to Dr. Vivek Rao. Because without them, their expertise, their knowledge, their access to state-of-the-art technology, many of my patients would not be taken care of. So I can tell you firsthand as a clinician of the importance of this institution and its support for programs like the Advanced Heart Failure Program and the Cardiac Transplantation Program, which you're going to hear more about tonight. Now, as a scientist with a laboratory in that beautiful glass Mars building, I can also attest that my students and I know that we're surrounded by some of the greatest scientists in the world. And we can, again, walk down the hall and get any new methodology, new technology, new approach to solving some of those vexing problems that we face in the hospital. So it's a real privilege for me to be given the responsibility of helping shape the future. And I just want to echo the pride that we have in the program that you're going to hear about tonight, and to thank not only all of you for coming, but for supporting this program and other programs at the hospital. Thank you very much.
Thank you, Dr. Hussain, and we really look forward to working with you and moving forward for more fundraising now for the Toronto Research Institute programs. Well, I'm very privileged to be asked to come up and introduce our next two speakers for the evening, whom you've all come to hear and see this evening. And I know you're going to be so impressed by the work that they do. It's mind-boggling. It actually makes one feel very inadequate to get up in the morning and realize that the work that I do on a daily level is nothing compared to what they do to save lives and make our lives what it is today. I'll start with Dr. Viv Rao. Viv is the Alfredo and Teresa de Gasperis Chair in Heart Failure. He's also the Surgical Director of the Cardiac Transplantation and Mechanical Circulatory Assist Program at the Peter Munk Cardiac Center. Dr. Rao was one of the youngest, and you can still see he looks incredibly young, one of the youngest surgical appointees to the Division of Cardiac Surgery at Toronto General Hospital in 2001. Due to his extensive training in transplantation and artificial heart technology, Dr. Rao was rapidly promoted to become the Surgical Director of Cardiac Transplantation in June 2002. Dr. Rao contributed to the establishment of Canada's first HeartMate artificial heart program in the fall of 2001. Now, there's no test on the years that I'm throwing out to you, but it is crucial to why we're celebrating today. And Viv also successfully implanted Canada's first HeartMate into a 47-year-old man who was dying of congestive heart failure at that time in 2001. This incredible feat was followed by the first Canadian female patient implant. This woman was 29 years of age on December 5th, 2001. She eventually underwent surgery to remove the device and remains one of only 3 patients in the country to be successfully weaned from an artificial heart without the need for transplantation. Unbelievable. Dr. Rao, in collaboration with Dr. Chris Feindel, who's a surgeon here at the Peter Munk Cardiac Center, also pioneered a novel technique to preserve donor hearts prior to transplantation. I'm sure he's going to speak to this today as well. Viv has won numerous awards during his surgical training and is the author and co-author on over 150 original publications and has contributed to 5 book chapters on various topics in cardiac surgery. He was awarded the Top 40 Under 40 distinction in 2007. Anyway, way too much for such a young man to have accomplished, and we're proud to have him with us at the Peter Munk Cardiac Center. Next, I'm going to move into introducing Dr. Heather Ross, equally a superstar. Dr. Ross is the medical director of the cardiac transplant program at the Peter Munk Cardiac Center and has been since 1997. She holds the Ted Rogers and Family Chair in Heart Function and is an associate professor of medicine at University of Toronto and the director of cardiac transplant at TGH. She is also the deputy director of the multi-organ transplant unit at Toronto General Hospital and the director of education for the Transplant Institute. As past president of the Canadian Society of Transplantation and a former executive member, Heather is a former executive member of the Canadian Cardiovascular Society. She currently is the secretary-treasurer for the International Society of Heart and Lung Transplantation. Dr. Ross is actively involved with Canadian, American, and international transplant societies and founded the Canadian Cardiac Transplant Group. She's author of over 130 publications and numerous book chapters in heart failure and transplantation, as well as the recipient of many teaching awards. Under her tutelage, the fellowship program has grown to an average of 4 to 6 fellows per year, and I'm sure that this afternoon you'll probably meet a few of the fellows who are part of the program, who are attending tonight. And the prior fellows have gone on to run heart failure and transplant programs in other areas such as Vancouver and Winnipeg, but also to other countries like Denmark and Argentina. So we're spreading the knowledge through Dr. Ross to other parts of this world. I have to add a couple little footnotes here that Dr. Ross is not only just an incredible doctor and the work that she does in saving lives, but she plays the saxophone. She sings, plays in a rock band, and she climbs mountains and takes treks to Antarctica with heart transplant patients. A woman of the day, and I just think she's, if only I could be, just a smidge like her. Anyway, ladies and gentlemen, please give us a warm welcome for Dr. Vivek Rao and Dr. Heather Ross.
So it's our pleasure to be here, and I think we have a bit of a tag team. Anybody who knows us knows that Viv is my work husband. I'm his work wife, and that's probably because we spend more time with each other than either of us do outside of the institution.
Fair enough to say.
So I'm going to start, and I'm going to give a little bit of a history and an overview of our program and some of the things that we've done, and then Viv is going to take on and move to talk a lot about. Let me just get to the top here. Viv's going to move along and talk a lot about the VAD program specifically. So what I thought is I'd try to put a little bit of a framework for you so that everyone could understand why we're actually here tonight. And I think it's important that we understand the problem and why we actually all come here and why the work is done at the PMCC that's done. And then I want to talk to you a little bit about our program, and I want to focus a little bit on some of the productivity that you've already heard about. I want to talk about the reason that we're really here, which is about the patients, and then I want to talk to you a little bit about some of the plans moving forward. So as you may know, heart failure is an epidemic, and heart failure means that your heart is not pumping adequately to meet the needs of your body. And in the field, we do consider this to be an epidemic, and the reason is that it's the most rapidly rising cardiovascular diagnosis. It's the single commonest reason to bring somebody to the emergency room. It's the single commonest reason for admission to hospital. And when we think about Canada as a nation, we know that there are over 500,000 Canadians who have heart failure and about 50,000 new cases diagnosed each year. Despite all of the advances in medical therapy, diagnosis, and follow-up, we still know that the risk of dying in the first year after the diagnosis is between 25% and 40%, and that for all comers, the average life expectancy after a diagnosis of heart failure is 2.1 years, and that is very current data. So really a profound diagnosis to give and a profound diagnosis for a patient to receive. When we think about the spectrum of heart failure, we know that at any given time, about 5% of people will have advanced heart failure. Advanced heart failure means that you have symptoms getting dressed, you have symptoms trying to eat, trying to shave, trying to do your hair, symptoms just resting, symptoms even when you're in bed trying to rest.